My name is Dr. Lisa Kohn. I'm a pediatric allergy-immunology fellow at UCLA. I'm going to talk to you today about food allergy, understanding treatment to improve therapy. 1 in 12 children in America has a food allergy, so parents and families want to know what can be done to prevent and treat food allergies. In my interactions with children in clinic, I advise them about what to do if they're having a life-threatening allergic reaction and how to try to avoid those foods to prevent reactions from happening in the first place. But beyond these brief clinical encounters, I know that food allergy permeates the life of a family. When there can be hidden ingredients in every food, any snack can be stressful. Adding to the stress is the change in advice that parents have received about how to introduce new foods. As the rates of allergies have increased over time, parents and families look to pediatricians, allergists, and scientists for solutions about how to treat food allergies. Studies of infants had taught us that early introductions of foods can prevent the development of food allergies. But we've learned that early introductions of foods isn't enough to prevent food allergies. It also requires consistently eating those foods and incorporating them into the diet. This combination of early introduction and consistent consumption is what's needed to achieve tolerance or maintenance of a non-allergic state. But what about those patients who already have food allergies? Can we use what we've learned about early introduction and consistent consumption to prevent food allergies and apply it to the treatment of food allergies? It turns out we can. There's a new direction in food allergy treatment called oral immunotherapy. Oral immunotherapy is a technique that we use in clinic to try to get patients to be tolerant to foods that they used to be allergic to. To be tolerant to the food is to no longer have an allergic reaction when you have an accidental exposure. The goal of oral immunotherapy is to achieve tolerance so that a patient can now eat a food that they were previously allergic to without having a reaction. The way that we achieve oral immunotherapy is that patients start by eating tiny amounts of the food every day, and then over time eat larger and larger amounts of these foods. This process to get to a state of tolerance can take months. And currently, we believe that patients have to continue this throughout their lifetime in order to remain tolerant. This is a major commitment for families, and so we want to better understand what's happening during this process to help inform our families and help them make better choices about it. Therefore, we want to address the many unanswered questions about how oral immunotherapy acts on the immune system to create a state of tolerance. What drives the shift from an allergic state to a tolerant state? Do overreactive allergy cells become less reactive? Is there an increase in T regulatory cells whose job it is to decrease the active immune response? In other allergic diseases like asthma, biologic medications can shift the balance between allergic state and tolerance. Are our patients who are undergoing oral immunotherapy having a similar response to biologic medicines? The current challenge is to understand the mechanisms responsible for restoring tolerance during oral immunotherapy. In my research, we are trying to understand the changes that occur in the immune system when we treat allergies. We will work with children who have food allergies before and after they undergo oral immunotherapy. We will look to see how the number of T regulatory cells changes over time. We will look to see if the allergenic reactive cells change by their number or their characteristic during treatment. Using cutting-edge techniques, we will examine which genes turn off and on in individual cells over time. This research can be used to better understand exactly what is occurring in people as they undergo oral immunotherapy. Infant studies can tell us about how behavior can impact the development of food allergies, but these studies don't tell us about the core changes that occur as infants become allergic to foods and what happens when we run the clock backwards and take a patient from a state of allergy to a state of tolerance. My research seeks to understand the mechanisms that are occurring during oral immunotherapy so families can be informed and make the best choices for their kids.